Good Tuesday afternoon, and thanks for joining us. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director of the Knox County Health Department. Our moment of gratitude today is dedicated to our kids, the kids in our community, who, like the rest of us, have had their lives flipped upside down. We think of the seniors in high school and college who are moving on from a chapter in their lives in a way they couldn't ever have imagined. We also think of the young children who could be having a hard time comprehending what's even happening. We are grateful for the creative ways in which the kids in our community have found special opportunities to create memories. Just last week, we saw kids participating in virtual proms. We are thankful for their commitment to find a silver lining, even in the midst of the unknown. Now I'd like to talk a little bit more about reopening our community. I want to begin by reiterating what I mentioned yesterday. This is not a return to business as usual before COVID-19. Our community has done some really good work to this point and kept our numbers down and has laid the groundwork to start moving toward our new normal. But we still have a long way to go. In our community reopening plan, we have 3 phases, each allowing relaxation of restrictions based on data and the current situation. In each phase, there are 5 core principles that need to be followed. Practice social distancing, 6 feet apart. Wear cloth covering in public if you can't practice social distancing. Wash your hands regularly and frequently. Clean and sanitize surfaces. And stay home if you're sick or have been asked to be in isolation or quarantine. We know there are many questions about specific businesses. It is not possible for the plan to contain all the specifics for every business in our community, or to even contain an exhaustive list of the employers and organizations in our community. Additionally, the health department cannot possibly sign off on every organization or provide individual feedback. To that end, we are building a multi-agency team to help answer questions and be a point of contact for different sectors of business. More information will be available on our website this week, including a listserv where employers can sign up for the email that will contain practical strategies employers can implement to protect their employees and customers. We ask that you please be patient with us as we anticipate the volume of questions to be high. We provide guidelines, the health department provide guidelines for several businesses every day to prevent the spread of disease, from restaurants to nursing homes to tattoo parlors. It's up to these businesses to put those guidelines into practice. No one knows your business better than you do. So if you look at the list and don't see your specific business, we urge you to follow the general guidelines that are present in the plan and see how they could be implemented in your business. If you have additional questions, the resources we mentioned above will be available on our website this week. Now move on to the local situation. We have 221 confirmed cases of COVID-19 in Knox County. 195 of those have recovered. 34 have been hospitalized at some point in their illness. Currently, there are only 3 people in the hospital at this time. And we are sad to say we've had another death from complications of COVID-19, bringing our total to 5. Our thoughts go out to the individual's family during this heartbreaking time. We also want to provide a bit more clarity on our data. You may see our positive case count remain the same over a span of a couple of days, or even go down. However, this does not necessarily mean that we aren't receiving new cases. For example, yesterday, our case count didn't change from Sundays. It wasn't because we didn't have any new cases. Over the span of 24 hours, our staff did their job of investigating each new case and learned that 4 cases belonged to a different jurisdiction, but we got 4 cases in our jurisdiction, so this number stayed the same. It's very common, it's not uncommon for cases to be reported to Knox County when they belong to a county near us, partly because they're hospitalized in Knox County, and sometimes some people are hospitalized in Knox County. Sometimes that's confusing, or maybe they went to the doctor in Knox County, or they got tested in Knox County. And until we clarify that, we don't know exactly where they live. And in full transparency, if a case is believed to be a Knox County case, we add it to our account until our investigation leads us otherwise. Once it's determined that it's not a Knox County case, it's transferred it out of our jurisdiction and off of our case count. We hope that provides some clarity about our data. Now open it for questions.
All right, we'll go ahead and get started with the questions. We got quite a bit today, so please bear with us as we work through a lot of text on our chat feature here. First question is from WBIR. Will dentist offices be able to reopen on Friday, including regular cleanings? What changes will they need to be required to make to keep staff and patients safe?
So the American Dental Association and the state of Tennessee and the governor's office have information about opening dentist offices, and well, that ADA doesn't have any information on opening medical offices, but opening dentist offices. Those are covered under the governor's order, and we'll be able to resume limited. They'll have to look at the order, and they'll have to look at their guidance from their governing bodies to be able to determine what they can do.
David, I see your question was also about dental offices. So if you had any follow-ups, I believe she answered your question there, but go ahead and submit it if you do. From WBIR, when will it be safe to visit family and nursing homes again?
Wow, that's a great question. And it's a tough one because we like to visit our family in nursing homes. They mean a lot to us, and we want to go see them and demonstrate how much we care for them. But they're also our most vulnerable individuals. We know that older individuals are so vulnerable to complications of COVID-19, and we just don't want to put them at risk. And the way they're going to get it is by us, who are relatively healthy, going into that facility and introducing it. Not intentionally, may not even know you're sick, or may just only feel a little sick. So honestly, limitations on visitation to nursing homes will stay in place for quite some time. That is, again, a state regulated entity, but those will stay in place for quite some time. And I'm glad they will, because it protects those folks from getting ill.
WVLT's follow-up question to the dental question a second ago is, are dental offices opening in Knox County on Friday?
So dental offices, again, are covered by the governor's order, and if the governor's order allows them to open, which I believe it does, they will open on Friday if they're ready to.
From WBIR, when can malls reopen?
Well, malls are retailers with shared space, and they usually have restaurants. So malls can open as long as they can follow all the guidelines for the restaurants and retailers and communal spaces when they're ready. So it'll be determined on their readiness when they can do that.
From the Sentinel, your phased reopening specifically allows restaurants, hair salons, and other in-person activities to resume with restrictions. You've asked people to stay home if they are sick. We know about asymptomatic transmission. How is putting the responsibility on individuals sufficient, given what we understand about how the virus can be unwittingly spread?
So all of the basic guidances that I went through, staying home if you're sick, washing your hands, wearing a mask, maintaining social distancing, cleaning surfaces, all of those things will help protect us. And what we know is that our community has done a really, really good job of following the guidelines, the more strict guidelines we have in place now. It was a little easier to close things down. Opening back up takes much more thought. And we know that our business owners will be thoughtful. They don't want to make any of their employees or any of their customers sick. And we know they'll be careful. That we put a lot of restrictions on some of those businesses because of the risk. But we know that they'll be careful and follow the guidelines and help protect our community.
From the Sentinel, studies have shown that HVAC systems can move viral particles within confined spaces such as restaurants, pushing viral particles beyond the 6-foot range. Have your phased reopening plans taken this into account? If not, why not?
So I'm aware of a study that did show the presence of virus in some HVAC systems. I don't think it showed any transmission of disease because of that. But I go back to the basics of, wearing a cloth face mask, washing your hands, being cautious. There's also some guidance in our plan that talks about engineering controls and changing out your air filters to reduce those risks. So there's lots of guidance there, and I believe people will be safe. We're acknowledging that we will see some increase in cases as people get out and move around more and interact more. But we're trusting our businesses and community to continue to do the safe thing and make good choices.
From WBIR, should we assume all festivals / public events with gatherings of 50 or more are canceled or postponed through June, and any festivals with gatherings of 100 or more are canceled or postponed through July?
What we know is that until the end, and 28 days from May 1st, all of those things are off the table. After May 1st or running up to May 1st, we'll be evaluating what's possible and how we're doing by looking at case counts, by looking at our hospital capacity, by looking at testing in our community, and looking at deaths as well. Using all of that data to determine, like we did this time, whether it's safe to move to the next phase. So I don't know what's going to happen after that. I'm not going to predict what's going to happen after that.
From WATE, Governor Lee said yesterday that elective procedures can resume as soon as Friday. The head of the State Hospital Association said that the exact timeline of resuming procedures would be a decision made at the local level. What's the plan here? If this is a gradual process, which procedures go first or which patients?
So the decision on how to move forward with elective procedures and how to change that is actually a decision made by our medical community. They're falling underneath the governor's plan and the restrictions the governor put in place. And then after May 1st, they're allowed to roll that out as they see best. And they have come together, and we've helped convene that group to make those decisions. And they know what they do best, and we don't know what they do and how they do it. So we trust them to make those decisions. And I do know that each facility and several outpatient offices do have plans to resume soon. I don't know exactly the date.
From WBIR, Governor Lee said yesterday he wants everyone to consider getting tested before they go back to work. Is KCHD on board / ready for that influx of people who are going back on Friday?
So I didn't hear what Governor Lee said. So what I will say from our perspective, anybody who's worried about having COVID-19, if they have symptoms, they need to be tested before they go back to work. I want to remind everybody that testing is a moment in time. It tells us whether you have it right now when I obtain that test from you. It doesn't tell us if you're going to have it in a few days. It just tells us about right now. So I'm going to go back to what I keep going back to, which is following the guidance of washing your hands, staying home if you're sick, wearing a covering. Some businesses are going to be required to wear cloth coverings, and their patrons are going to be required to wear cloth coverings. Those things are all important. Cleaning surfaces regularly. All of those things will help prevent other people from getting sick. We encourage employers to look at sick leave policies so that they allow people to be home if they are sick and stay home until they're well for 72 hours without any medication to treat their symptoms.
From WVLT, when is KCHD posting on the website COVID safety signage and information for COVID coordinators?
That'll be done this week.
From the Sentinel, what specifically are the enforcement measures for the phased reopening rules? The free market did not stop many businesses from trying to conduct themselves as normal earlier. What would stop them now?
So I would argue that many businesses didn't follow I think many businesses did follow the rules and follow our guidance, as is evidenced by the fact that we don't have a lot of cases. Our case counts have gone up slowly in Knox County. And the other reason we know that is because our contact tracing showed us that most people only had 4 or 5 contacts, which is really unusual in a contact tracing situation because people are going to work and doing lots of things. So we know people weren't doing that. We're encouraged by that. So under public health law, we have authorities to encourage businesses to comply. We regulate several businesses. Let me start just with education. And then if that doesn't work, we we step it up to a little more forceful education and information, and it can even go further than that. We usually find that people comply once they understand the seriousness and that we are taking it seriously. Again, the businesses in our community want to stay open, and they want to keep our community safe, and we're relying on that. We're relying on their goodwill to be compliant, and it almost all the time works.
From WATE, retail stores are able to open May 1st. The mall is full of retail stores. Will the mall be able to open on Friday?
The mall falls into a retail store. They also have some restaurants in there. And so they can reopen if they're able to follow the guidelines that are set forth for all the different things they have in the mall.
From the Sentinel, the reopening guidelines reference a set of screening questions KCHD is going to provide to businesses to ask customers as they enter gyms or salons. What are those questions?
So those are questions about whether somebody is sick. So those questions are, do you feel ill? Have you been told if you've been, have COVID-19, or have you been exposed? And so those are some simple questions to ask people that say, you know, if you're feeling ill, if you've been exposed to COVID-19, or you've been told you have COVID-19, we're not going to be able to allow you to have your appointment or come into our facility. Those screening questions are also for employees to keep sick employees from being at work.
From WATE, can we know more about the fifth death, gender, age, location?
I will be posting the information that we post on the website.
From WBIR, with the recommendations for churches, is it even realistic for them to hold worship services this weekend or in the near future, parentheses, not singing?
That is up to the individual church to figure out how they're going to accomplish that. They've proven to be really creative to be able to continue offering our community an opportunity for worship and connecting with each other virtually and in lots of creative ways. So I trust they'll continue to do that.
From the Compass, your order yesterday extended the stay-at-home order through Thursday. Do you have to issue a new order effective Friday to legally activate the plan?
That depends on what the governor does. So we'll have to wait and see what the governor does, whether we need to do a new order locally. That decision will be made later in this week.
From, let's see, I'm scrolling. From WATE, if any of the 50 plus patients from the Life Care Nursing Home in Athens have been brought to Knoxville for treatment. They're asking if any of the 50 patients.
That's not information that we would have.
From the Sentinel, can you give any more information on the county's fifth death?
I'm sorry, I'm not prepared to give any of that information. The information will be posted on our website.
From WBIR, Knox has businesses opening Friday, salons, barbers that remain closed in surrounding counties, meaning people could travel to our county for these services. Are you worried about possible spread of disease / crowding because of this?
Yeah, people certainly can travel to Knox County to receive services. People do travel to Knox County to receive services. And again, I'll go back to the guidance that we provided that particular industry for how they can operate safely. That applies to everybody who comes into their facility. And we trust that they'll be following that. And I also remind businesses and the community that we're not demanding that anybody reopen. This is an opportunity, if you can meet the guidelines, to reopen if you feel like you can do it safely for your employees and for your customers. So there's no requirement that anyone reopen.
Any other questions? Please go ahead and submit them. From the Sentinel, you talked a lot about education, but my original question was about enforcement measures. What powers do you have specifically to enforce these guidelines, and how will you deal with repeated violators?
Education's a part of my enforcement plan. Education is a big piece of what we do. We regulate restaurants, tattoo parlors, and other industries all the time, year round. So we start with education. It's part of our enforcement, teaching them what the rules are so that they can be compliant. If they're not in compliant, Tennessee code spells out specifically what has to happen to allow any further action to be taken. They have to be provided the opportunity to make corrections. And that's followed by what's called a health directive. It's a little more sternly worded notification that they should start doing what they need to do. And that can be taken further if needed.
Any other questions? Please go ahead and submit them now. From the Sentinel, I specifically asked earlier about the movement of air through a confined space. The study I mentioned was not about air filters. It was a contact tracing study within a single restaurant that showed viral particles moving beyond 6 feet of a single case, causing an outbreak cluster at the restaurant. Can you please explain how your plan addresses this, because you did not earlier?
I'm not familiar with the study you're referencing, so I can't speak to that study. It is just one study, and in science and in medicine, we look for a body of evidence, not one piece of evidence to tell us how to make decisions. And again, it gets back to cleaning and wearing face mask and proper air ventilation, not just air circulation. And there's information about air ventilation in our guidelines too.
From WATE, do you have sufficient staff to examine retailers for compliance?
We have a team who are going to be helping us do enforcement. So the team is made up of county folks and county staff and city staff, as well as our staff, who will be educated and be helping us do those compliance checks if needed. It's how we've been operating the whole time we've been shut down, and it's worked really well.
All right, any other questions? All right, if there are no other questions, thank you all for joining us, and we will be back tomorrow at 12:30. Thank you and have a good day.